addition to this week's sharing COVID-19 experiences, this week we are going to be focusing on reopening strategies, and in relation to that, some ideas on cleaning and sanitizing and keeping staff and community members safe when eventually you are able to reopen. So to help me cover that topic, I've invited a couple of ICFL staff to help me out. Annie Gaines, who is the continuing education consultant, and Emily Sitz, who is the field consultant for Up North. Hello, Emily. And then we also have Patrick joining us. Yay! Another field consultant. Hello, Patrick. So Patrick, if you'll help me kind of monitor the chat, that way Annie and Emily can focus on what they're going to be chatting about, that would be much appreciated. Let me see if there are other ICFL staff on here as I scroll through the many pages of pictures. Nope, I think that's it. Cool. So, so with that, I am going to go ahead and hand it over to Annie and Emily. Take it away.
Yay. So actually first we're going to have Emily talk a little bit about some reopening strategies. She's done a little bit of research to sort of present to us today for us to look at and talk through. So Emily, if you're ready to go, feel free to share your screen.
Okay, now it's really starting to spread bad. Yep.
And if someone will enable a screen sharing for me, or if you'll go ahead and put up the document, the plan outline.
I think Dina, there we go.
Let me go find it, but I'll get it up here in a second.
Okay. Okay. Well, good morning, by the way, from beautiful downtown Moscow. I hope you're all well. This phrase has taken on a new meaning, new significance, anyway, during this pandemic. But thank you for joining us today. I'm going to share some of the information I found while researching reopening plans, and I'm eager to hear what you all have found and what you're doing. I'm going to run through a few things, and then we'll open it up for discussion. And we'll also post what I'm presenting as well as examples of plans on our COVID-19 page.
Emily, which document would you like me to bring up first?
I would appreciate it if you would bring up the COVID-19 reopening discussion.
Okay.
Thank you.
Just a second. Let me get it optimized.
Okay, perfect. Thank you. Thank you. So what I've put together is a reopening plan framework with elements primarily from the Center for Disease Control's recommendations for interim business reopening. And I also hit several library-specific recommendations, including the Texas State Library and Archives Plan for Libraries, Communications During COVID-19, and we'll post that on our site. And I recommend having a look at this. It has, it's arranged by phases, and it has good questions and provides a framework for communications during the phased-in reopening. And communications represents one layer, an important layer of planning, and their plan also has some elements of advocacy, which is really important right now. And don't forget your budget during this planning process. You know, do you need to shift line items? What about your long-term personnel strategies, et cetera? And as ICRIM, thank you, Craig, I know you're out there, will tell you your primary partner in planning is your local or regional health department. And so if you're looking right here, a phased-in approach makes sense. It's running parallel to, you know, the release of the stay-at-home orders, gradual release, and it seems that many in the library world are taking this approach. And the phases describe, as you can see, a movement from closed to the public to normal operations. And as we're working through this, we know that one size doesn't fit all necessarily, so all things will not apply to all situations. So that looking at the Texas model, you can see that we are pretty much in phase 2 right now, quickly moving on to phase 3. And we know this situation is fluid. We don't know what's coming next. We don't know if everything will be better sooner than we thought it would be, or we could have another spike in the fall. So it might be helpful to think of this as a spectrum on which you could bounce back and forth a little bit. You may have to, go back to a more restricted setting, depending, if your community becomes a hotspot. And so it might be prudent to take some reflection when you have a moment, as we're moving out of this initial stay-at-home phase. What were the actions that were taken, and what feels like a tidal wave? Are they sustainable for the next wave that may or may not be coming? And so the ICFL cannot provide templates, but we can provide policy and plan examples. And we'll be posting several to the COVID page, and they were largely gathered through the ARSL listserv. And many of the plans I've viewed have tended to focus, understandably so, on public services, especially collection-related services and issues, and programming. And several also include references to staffing and sanitizing. And I've included information from the CDC's business plan because it provides another layer of detail that I'm not yet seeing in the ones that I have reviewed. And Dina, can you bring up the, it was a PC, it was an example. If we can pop that up quickly, and if not, we'll just move on. Okay, well, no worries. We'll have them up shortly after this on our site. You can have a look at them. Oh, do we have something? Okay. Okay, yeah, thank you, Dina, very much. This is one, this is example of, just using those phases, going from a closed to open, kind of where people are focusing. Yeah, if you can scroll down just a bit. Thank you, Dina. And there's summer reading coming right up, as we all know. Okay. So this just to give you an idea of what this phased in looks like. And if Dina, if you would please put up the agenda back for me. Thank you. Thanks very much. Okay, so here are the goals for the CDC's interim plan. And I've added that bit under the third bullet about a healthy public space, so we know how important this is to our community and our staff. I've translated the CDC's plan components, into library speak. And these components in turn move into policy, procedure, and practices. So let's look a little bit more closely at the CDC's goals. The first two are reducing transmission and maintaining healthy business ops. And activities under this goal are in bold. And, this is the first one, this is something you really need to talk with your local health people about. Chances are you'll want to have a procedure where staff notifies their supervisor if they have symptoms, if their family has symptoms, and then you'll need to take action probably to quarantine those staff. And as directors and staff people, who may be vulnerable, considered high risk on your staff. So take care and be mindful of ADA and HIPAA related guidelines when you're considering individuals on staff. And educating employees. Posters are available on the CDC website. and they are recommending some action steps here. And we know that human resources, personnel-related responsibilities vary between city and district libraries. And, you know, frankly, you may already have some of these in place, but these are policy and procedures that may help you to gain that flexibility during this pandemic. And it really comes down to being a safe and supportive employer, and as a staff member, a respectful team player. And it's been so nice to see library boards stepping up all over the state and really supporting staff. That's been pretty cool. Moving on, another aspect of a healthy business operations is assessing essential functions, and you guys are already there. You're doing what you've now seen what has worked during that first phase of stay at home, and now you're moving into a less restricted environment. And we will email and post all these docs after the session. And these elements are appearing in various phases in the plans that I've reviewed, and no doubt they are uppermost in your mind. So we're talking about collection services, you know, safe handling procedures. Also, you know, for those of you who are in consortial resource sharing agreements, some of you are already working on, you know, statement of shared responsibilities in this context. You know, should we open the book drop? Or do we have the physical space in our facility to quarantine objects, or will we need to put them in boxes? Do we, you know, a lot to think about, right? And you're probably going over it right now. And then I put access to facility down as an essential function, because if I were a director right now, this would be one of the big, you know, million-dollar questions. How are we going to do crowd control? Are we going to, you know, let people in, so many people in at a time? I've seen a little bit in various some people are doing a ticketing system. People are working on it. It's something definitely we'll have to think about. And then cross-training, you know, is another element, which leads us into that next action item, is determining how you operate if absenteeism spikes. You know, and this may have seemed far-fetched, you know, a couple of months ago, but right now it's very, you know, what we know, knowing what we know about transmission, this could easily occur. You know, what happens if you're a 1 or 2 person shop? And so it's an important part of the plan and something to talk to your health department about. And, you know, if people are quarantined, can they work from home? You know, what kind of flexible policies can you implement? And under that cross-training bullet, that third one under absenteeism, we'll give a shout out to Kevin's succession planning notebook. This will have some handy information for you, as well as your procedures notebook. All righty, so let's, and then, you know, considering policies and practices for social distancing. You know, we're already there. Some different ways to, you know, flexible work sites. We're already telecommuting. Will you continue doing that as you're phasing through this? Are staggered shifts something you can consider? And another question is, should key staff be working together? You know, if you do have some sort of, and it's all dependent on your staff size and so forth, but, you know, is that something to consider? And then down on, you know, delivering services remotely, you know, you all have risen to the occasion with this. And by the way, don't forget to count your statistics and advocate for yourself. Get your board out there talking about what you're doing in this time of crisis. And by the way, ALA has some really nifty COVID-19 advocacy tip sheets that I'm going to be forwarding to Live Idaho this morning. So those should come in handy for you. And then another, you know, curbside, of course, we're in the kind of midst of that now. So those are more procedures that have to be worked out. And then maintaining a healthy work environment. If you'll move me down a little bit, Dina. You know, this is important to your staff and as a public building. you know, it's really important to your public that you be vigilant about about their safety. And I think they will be. Thank you for being diligent. And, you know, don't forget about asymptomatic spread, which is, you know, probably one of the really scary things about this disease. Air quality, that'd be great if you can get some more fresh air in the building. Crank that, recycle that air a little bit more quickly than you typically do. And then, you know, supporting respiratory etiquette, this is another area where you may have to make some budget adjustments and, you know, changing line items a little bit to be able to spend more on cleaning supplies and sanitizing products. And I think the question of the day, which might be a good discussion point, is, are you able to get these products? Where are you sourcing them from? And what will you do if you are having trouble getting some of this stuff? So they're really recommending just having, you know, sanitizing stuff kind of all over your facility, just here and there. And then, you know, routine environmental cleaning and disinfection, another, you know, important part of your plan. How often are you doing this, and how can you be systematic about it so you ensure that you're maintaining the safest and healthiest environment that you can. And we see some people are already there. If you didn't see the chat, solutions in the chat. And, you know, in terms of the environment, it may be time to just take some stuff off the floor, like VR headsets, you know, the lovely toy kitchen stuff, you know, all the, you know, children's department especially has a lot of manipulatives that may be better just taken off instead of trying to manage the cleaning. And then will you, if you do know of a staff or person who has, you know, who is infected, will you do a deep cleaning, and will you close to do that, or how will you manage that? So a lot there to go through, and this is what I have. This is basically the CDC's business outline. So I think, Annie, if you want to talk about sanitizing, or if we want to open it up for questions or discussion. Thank
Sure,
you.
I'll just really quick add a little bit about the materials handling safely situation. And so what we know right now is that the virus can live for 24 hours on paper and cardboard. So that would be books. And then it can live for up to 72 hours on hard surfaces like metals and plastics. So that's why encouraging you to take like the toy kitchens away just saves a whole lot of time. Rather than, you know, individually disinfecting each piece of plastic food, you can just take the whole set to the back and not have to worry about it. The same thing with VR headsets. That's a lot of plastic and some fabric too. Things that are fabric, I've read that it's about 24 hours it can live there. And so if it's a fabric that you can wash, you want to wash it at the hottest water temperature that you can. But if it's, you know, a little bit of felt on a board book, in that situation, it might just be easier to quarantine that book for 24 to 72 hours just to be sure. That way you're not putting too much effort into something and taking up valuable time. That was one of the most valuable things I learned in doing a little bit of research for this chat, was that oftentimes the easiest thing to do and the most time efficient thing to do is to quarantine the materials that come into your library in a separate room with air circulation for 24 to 72 hours just to be safe. And that's one of the recommendations that I've read. So that was just a little bit that I wanted to add before we kind of open it up to everybody to talk. So I'm really interested in hearing your thoughts and what you've been doing so far.
So feel free to unmute yourself and share what discussions you've been having at your library about reopening plans, or even if you have your book drops currently open, how have you been dealing with those materials that you're taking back into the library? Or if it's easier for you to put comments and questions in the chat, feel free to do that. And Patrick and I will make sure that those kind of rise up. Also, we will be sharing this recording and the 2 documents that Emily shared, which were amazing. Thank you, Emily, for your work on those. We'll be posting those on the COVID website, and I'll send something out to the LibIdaho listserv once I've done that, so that way you know that resource is available for you and as you plan going forward.
This is Claire in Nampa. I'd be interested to hear people's thoughts on a couple of things. So when we do start to allow patrons back in the building, children are one of my biggest concerns because they're all over the place. That's number one. Does anybody have any good ideas about that? And number 2, technology, computers, iPads, that kind of thing. How can we possibly open that up and sanitize without putting our staff at risk and making sure things are done appropriately? So those are just a couple of questions I had.
This is Sasha from Eagle. One of the things we're talking about doing is getting rid of our desktop computers and having laptops for checkout only, so that the laptops are coming back to us after use so that we can sanitize them for the next person. That's just an idea.
I wonder if computer management systems may help. You know, if you can put some time in between sessions, that would allow staff to go out and clean, wipe down in a traditional non-laptop setting.
Are we putting our staff at risk? It's to me, that's I know that's what's really needed by our patrons, but it's a big concern. So I guess we'll just have to figure it out as we go. Thanks.
Well, one thing that I think about in that scenario is spreading out your computer area to make sure that each person is sitting 6 feet apart from each other. That might take some finagling and some moving some furniture around to accomplish, but that would eliminate some of the concern about a lot of people interacting with a space, so it would just be that one person interacting with a computer. If you could also try to encourage all of your patrons to wear masks if that's possible, and encourage your staff to wear masks. Those are the things that I was thinking about.
And Annie, that's kind of in line with Stephanie Aberdeen says that they're allowing one patron at a time to pick out materials wearing a mask and using hand sanitizer. And they have masks available for use if the patron doesn't have one, and they're letting them keep it, which I think is kind of a nice way to go about that. And I have heard that with other libraries for a variety of things. One of the things that they're doing is they're putting things out that people can take and they don't want them back. So whether that be books from your friends, whether that be activities in a bag that people can take home and do at home, but the idea being that that's one way to help kind of manage some of that possibility of contamination, is making things available that you have no expectation of coming back. Also, there's a question, how are libraries deciding how to move from one phase to another? What data are they using to make that judgment? Emily, is that something that you kind of came across in your research at all?
Yeah, and you know, it's going along with what your the governor is doing and what your local your mayor is doing in terms of, you know, really easing restrictions. So, you know, kind of go along with that, and you know, as long as, you know, we have a minimum group, you know, number together that will guide you to 10 or less people, you know, crowd control, those types of things. So the government is, you know, the governor, excuse me, is leading us in many respects, and as well as maybe your local situation if it is more stringent. If that, does that help?
I also just put a link in the chat to a map of Idaho's different health districts. So there are 7 different health districts in the state. So they are an excellent resource to get in touch with of like, is it safe enough in our community to open up? Is it safe enough to move from this stage to this stage? They would be the ones to know. So I would recommend reaching out to those, your own health district.
Yeah, absolutely, because, thank you, Annie, because your community could, you know, be a hot spot, and so you would have different guidance there.
Also from the chat, it looks like one library, it's been suggested that they toss garbage sacks over every other computer, which would space patrons out and keep some computer stations clean. An interesting solution. One thought I'm having with that is what message is that sending to people coming into the library? And is there another way that you could achieve the same thing? Like, what if you removed the keyboard and the mouse from those computers, but you know, maybe still had the screen and the CPU there, but there was no way to physically interact with it? But yes, the idea of, like Andy said, kind of adjusting your computer stations to make sure that people are keeping a safe distance. And a good question about how will we practice social distancing when patrons require assistance on the computer? How do you maintain distance when they need to show you on the screen what they need help with? And that, I think, is an excellent question. And I think that goes back to, depending on what the, where your community is in that curve of how safe it is to have those interactions. Certainly, I would think that still having PPE available for your staff is going to be key. But also, I don't see, you know, that's not the first step after reopening, is having those sorts of interactions happen. Let's see, and a question, I'd like to hear more about what other libraries are doing for their contactless curbside service. Yeah, I'd be curious to hear what some of those solutions are that you've come up with as well, or if that's something that you're even discussing at your library at this point.
I'm just curious, along those lines, how many of you, either raise of hands or reaction with a thumbs up or whatever, are actually doing curbside right now, or still? Yeah, so if you are, okay. Everyone from Nampa has given me a thumbs up, so good job, guys.
So this is Mary from the Ada Community Library system. We started curbside before the order came to close on the 25th. So we have not restarted again, but we got a little trial run before we closed for about 6 or 7 days, and it went fairly well. The way our system works is we have bins outside of our locations spread out within the distancing, and then patrons can call in and request just generic, can you get me, you know, 10 picture books or whatever, or they can put items on hold. We were doing hold specific to the location. So if they wanted to pick up items at the Hidden Springs branch, they could just put on in the catalog holds that were in-house already, and we'd pull those. So they just pull up outside, call us, say they're there, and we check out their items and put them in the bin. And then we go back inside, and then they would pick it up in bin 1 or 2 or whatever. So that worked fairly well for us. And then at that time, we were still doing returns into the book drops, but our book drops are closed now. So I'm not sure how we would deal with returns, but I assume we're going to start curbside again, but we're not currently doing it.
Excellent, thanks, Mary. And it looks like there's a question, are there any civil liberties issues with requiring patrons to wear masks? An interesting question.
My take on that would be that this is kind of an emergency situation. I mean, the governor has declared a state of emergency. So that's my take.
And it could be if that is something that that you're thinking that some of your users will have a comment on, perhaps. You can always go back to it being from a safety perspective of that you're wanting to keep your staff safe. Also, if there are options for service where a user doesn't have to wear a mask, so some of those curbside no contact options are perhaps another solution to offer to folks that are not keen on wearing a mask for whatever reason.
Yeah, I have the Moscow / yeah. I think it's saying my password's not.
No.
I wanted to talk more about the computers, because we feel at the Eagle Public Library that they're very important to get people computer access at this time, because to fill out unemployment, look for new jobs, that kind of stuff. One of the things that was brought up was a possible I can't remember who asked the question, but being able to look at the person's screen. We haven't looked into it a lot. We're going to have our IT person look into it, but some possibility of a program, and I don't even know if it exists, where you can actually be on your own computer and see whoever, computer one's screen. So you can actually help them from a distance. The biggest issue we're coming across while discussing this is, I can't remember how he put it, but people's, I'm blanking, I'm sorry, but their privacy, yeah. Like, how are people gonna feel if they know that we can look at their screen at any minute, but they really shouldn't be doing anything that we can't look at. So that's just an idea, if it's possible.
I think that's a great idea. In the products that I'm familiar with, you would have to initiate a session. So they would have to agree to a session. So it wouldn't be like you were, you could lurk on everything. They would have to agree to share their screen.
I think that's a great solution. I mean, in some ways, it gets around the whole issue of even having to interact with them. And I'm pretty sure there are even some free tools that might allow people to do that. And that might be something that that one of us can reach out to Dylan and other staff and see what suggestions they might have. And when we post the chat notes from this recording, we can maybe include a resource or two along those lines.
And then one other thing I wanted to mention, we have mobile printing available. Mm-hmm. So we are going to offer people to, send us their print. We'll release their print, and then we'll actually mail them their prints. So that's, if you have that available, that might be something to think about.
Yeah, we've been doing that. We've got a lot of schoolwork going out. It's been not as used as much as we expected, but we do have it available, and the people that are using it really like it. So it's working pretty well.
Okay, thank you.
So a couple things from the chat. There's folks mentioning lots of mention of computer use, and obviously that's one of the things that a lot of folks in our communities turn to the library for and rely on us for. So that's definitely makes sense that a lot of people, that's at the forefront of your mind, thinking about what services you're going to be able to offer, especially as more services are going online. So mention of people filling out unemployment applications. And I know a couple of other libraries had talked about also helping small businesses fill out applications for those funds as well. So yeah, I imagine there will be a lot of need for that. And that remote computer idea from Eagle is awesome, would definitely help with that. Let's see. So yeah, so a little bit of chat about, yep, there is definitely software that allows that remote access to happen. And as Emily said, some of the tools I'm thinking of, it is a session-based thing. So it's not that you can just go in the back end and see what people are looking at without them knowing.
Hi.
Hey, Craig, what's up?
Yeah, we're also putting in some plexiglass sheets in between computers, closing down every other computer to keep that 6-foot distance. And we're planning on putting plastic sheeting around our circulation area, kind of like at the post office, so that we can help protect our staff.
That's great. And a lot of those solutions sound like things that I've been seeing at grocery stores as well. So in chats that we've been having about this internally, that's one of the things I've kind of been thinking about is, you know, a lot of times libraries kind of borrow from the retail world. And as all of us have been going to the grocery store over the last month or so, I'm sure that we've all seen changes in what that experience is like. And so that might be, you know, you can think of that as they tested those ideas for you, and think about how some of those might translate into your library space when you do reopen or at those different phases of reopening.
So I have a question for possibly Nampa, because it seems like they're still in the building working. Some of you may have been to the Eagle Library, but we're pretty small and we're quickly running out of room. So we're packed into our offices. We have 1, 2, 3, 4, 5 people in an office at one time, and then we have 7 in the children's office. How are you keeping your staff 6 feet apart? Are you staggering shifts? How are you keeping your staff, or this could be for anyone, but how are you going to keep your staff when you reopen apart?
This is Claire from Nampa. Right now we only have maybe 5 to 7 people in the building at a time, and we have a large building, but I am requiring them to wear masks. We got masks from our police department, and we have gloves, and we have sanitizer, we have wipes, we have all that. And it's not going well. People don't appreciate having to wear masks. I understand it's not fun at all. I mean, even just the simple paper ones, which is what we've got right now, it's just uncomfortable. You don't feel like you can breathe properly. But we are insisting they also stay at least 6 feet apart. And we've got lots of hand sanitizer and other things and washing their hands, as I said. We've got signs up all over the building. And so we're limiting our steps. We only have a few of them. But the mask thing to me is something that's just going to go on. I don't know when we're going to, and I'm going to ask our attorney too about, I'm requiring them to wear masks now, but should I be? Is that okay to do that? You know, so that's a question I have right now.
If I can have a moment, does anybody have any signs out there like the ones they have in the post office that talk about the social distancing, or just talk about the recommendations so that you don't have to like stop somebody and go, please, you know, do this? If they could just read the sign, see the recommendations, be reminded. So is there anything out there created right now, or do you know where we can get signs similar to like what they have at the grocery store and the post offices?
You can go to the CDC website.
Okay, thank you.
Good signs. Mm-hmm.
And I just want to comment on that. From going to the grocery store, people don't read the signs, unfortunately. So you're going to have to I feel like you're going to have to get used to just telling people, because people just don't pay attention, and people have marks on the ground, and there's arrows, and there's all these things, but people just aren't paying attention. So
It's also new, so it's changing the experience that people have been having at your libraries or at the grocery store. And so that might be a staffing thing to think about, because that is a good point. It's nice to have a sign for people to point to, but it's also nice to have a person directing people's attention to it, and also maybe having some staff to kind of help direct flows, as those are things that are probably going to be changing a little bit. And as some of those new practices become more normalized, maybe you'll need less staff around to kind of remind people about some of those things. There was a question in the chat that was interesting. Is anyone offering special open time for elderly or high-risk individuals? Or is anyone thinking about offering that option when they do reopen?
Aren't some grocery stores doing senior shopping time, do you know?
Yeah, and I imagine that might be the inspiration for that question, which I think is a great one, and depending on your community, might be a really great thing to be offering. There's also the idea of talking to your legal department about some of these things that you might be requiring staff and or customers to do, I think is a good point. I don't remember who it was that kind of brought that up, but that's a good point. Let's see. Oh yeah, and then there was, are those mask legal questions something ICRIMP can address? I have to admit, I'm not familiar with what ICRIMP is. Anyone?
I'll jump in.
Thanks, Patrick.
If you are one of the people or one of the systems who uses ICRIMP as your risk management provider, absolutely you can reach out to them. They'll probably advise even if you're not. But if you don't know for sure that you're with ICRIMP, then you're probably not, because you would know who you're, or at least your director would know who they're flipping a bill to. So.
There's another question in the chat about if libraries are developing policies on how to deal with people who are becoming disgruntled about social distancing guidelines or aren't following the guidelines that you're setting in your library. And I think this is a really good question, because a lot of times in libraries we think about it's good to sort of anticipate the various problems that might occur, especially with censorship challenges, for example. So having some kind of even an informal policy that lists out, like, okay, if someone is refusing to wear a mask and is openly coughing in the library, what do we do? You know, having a quick, easy plan and having that communicated to the staff once you're open to the public, I feel like would be a pretty good idea. But I'm interested to hear what others' thoughts are.
So basically, you would amend your existing patron behavior policy for this particular pandemic.
Or even just temporarily. I guess it would depend on your library and your board if you wanted to make those official policies in your policy guidelines, or if you wanted to just make something temporary for this sort of emergency situation that we're in.
So I just posted a link in the chat. There was mention of some of the printable materials that the CDC has put together. So that's the link I just threw in there.
It looks like Stephanie from Aberdeen says that they have a policy stating that people can be asked to leave if they're not using proper communicable disease actions, which is a good policy to have even when we're not in a pandemic. I feel like that's good.
And I'll just point out, every policy is a temporary policy because the board can change it whenever they change it. So this one would be temporary as well.
At the Eagle Library, we've been doing Zoom meetings, and we've decided to have a safety committee, because you kind of think, okay, if a person comes in and they're upset and then it kind of escalates, what are we going to do? And then we had also discussed when we figure out when we're going to open, we want to do like possibly a half day where everybody comes in, we discuss what will be said for who, so that we're all on the same page, we're giving our guests the same information. So I don't think we've quite decided what we're going to do, but we'll definitely be discussing it before we open.
And once that's a great point, Sasha, that you know, keeping in mind that your staff are also potentially going to be kind of stressed, and some of them might not feel comfortable coming back to work, or they might have underlying health issues that make it dangerous for them to do so. So flexibility and compassion, I feel, are two words of the day to keep in mind as we move forward. There's a question in the chat. Is anyone at this offering services by appointment only as a way to kind of offer some built-in social distancing? Is any libraries are they thinking about doing that?
Our library, the Latah County Library, is talking about doing curbside hold pickup where people call ahead. Come pick up their holds. We bring out to them.
Can you turn your volume up?
I don't
Maybe.
know.
Or speak louder.
Oh, here we go. So the Latah County Library is doing curbside hold pickup. We haven't started it yet, but we're talking about it. Basically, patrons call ahead for a time slot, and then during that time slot, you're talking about like 2-hour time slots. They come and we have it outside, well, a table, a booth, and that they can pick it up, basically. And so like when we bring it outside, before we do that, we sanitize it and all that, and then bring it out to them.
And so Joshua, are you considering offering other, like aside from just taking stuff to them, is there also the option of having like a reference consultation curbside, or are you mostly just looking at delivering materials to curbside at this point?
We've been talking about delivering materials, but I'm sure we can do other things like that. That's a good idea.
Looks like, and Joshua also asked, are these proposals if and when the state stay-at-home orders are lifted, right? So my understanding is that technically, based on the amendment that went into effect last week, curbside is something that falls into something that libraries could be doing right now. So already kind of easing into some of those early stages of reopening fully. Mary has a question. Has anyone talked about opening at first to the public for only a set number of hours a day?
And that's definitely a reasonable way to sort of phase in having sort of your staff come back into the library. You could start out doing half days where half of the day you're open to the public and the other half of the day it's like a long staff meeting where you're going over that kind of information, getting everyone on the same page.
It looks like there's a question, is library curbside different from others because the materials would be coming back? So different in that as far as how you handle those materials when they come back, yeah. I do know some libraries that are doing curbside are actually still telling people to not bring those materials back. Like they're doing curbside pickup of holds, but they still have their book returns closed, especially smaller libraries that just don't have the physical space to be quarantining large piles of materials at this point.
We didn't want everything to come back at once. And so we are allowing it to come into the book drop. And then we, with gloves and masks, just get them every few days, put them in tubs and quarantine them so that we're not doing it all at once. And if they come to curbside, they can return them to the book drop, but we won't take them from them.
Gotcha. That's great. Thanks, Stephanie. That's a good strategy to hopefully lessen the burden on your staff as well. Let's see. Has the ICFL spoken specifically to the governor's office about the unique curbside for libraries where items go out and come back? That I do not have an answer to, but it's certainly something that if anyone else from ICFL knows if we have spoken about that, certainly something that we can post to Stephanie and Tammy.
I'll be bold and say I don't know too.
Thanks, Patrick. I appreciate that.
And it sounds like from others in the chat that they are also extending their due dates to later than those materials would normally come back, to sort of stagger that coming back to the library, which makes a whole lot of sense, especially if folks are working from home and no one's there to collect the materials. So the last I heard, there's a question about CDC confirmed numbers on how much time the virus lives on paper. So the latest guidance that I've read from the CDC is that paper and cardboard, the virus can live for up to 24 hours. And then it's plastic and other hard materials that it can live up to 72 hours. The thing that I think about with books and libraries, especially a lot of them have those really nice plastic covers on them to keep them safe and lasting a long time in circulation. And so that could be a combination of two different materials to think about. So if that's a quarantining situation and it's a book that has paper and, you know, plastic covering on it, that could be a 72-hour quarantine just because of the variety in materials.
So I'm super confused on this whole thing. I'm trying not to watch too much news and stuff. So when it says paper and cardboard and plastic, I mean, does that mean with airflow? Does that mean one piece of paper? When you have a stack of paper, it's trapped in there? Like, I'm a little confused on when it says, you know, and then we've been stacking the book, so is that going to take even longer because then there's no airflow in between the two pieces of plastic? So I'm a little confused on what it means by paper and cardboard.
That's a good point. So as far as I know, like so say we're talking about just a paperback book, and someone's used it and returned it, and it could potentially have some virus on it. The virus will just die over time. No matter what sort of happens to the book, it will deteriorate over time and become unable to function as a virus. So as far as the research that I've looked at, there didn't seem to be a difference between like materials stacked on each other or like you had to spread out the pages of a book. As far as I understand, it's just leaving those things for enough time that the virus just dies on its own. And that way you don't have to worry about it spreading to anything else.
Thank you.
Does that help?
Yes, it does.
Okay.
There's also we're coming up on 11 o'clock. There's one last question here in the chat that I want to make sure we get to. Can you share good sources about where to procure PPE, sanitizer, and cleaning products? Not really. A lot of that is going to be, which I know is totally not the answer you're looking for, Susan, I'm sorry. A lot of that is going to just be determined by what is available in your community, at your local retailers. I know I did see something where I believe libraries, Amazon has put libraries in kind of the next level of who they're prioritizing, of who they are shipping required materials like that to. That's no guarantee that you're gonna like get them lickety split, but it does mean that you're moving up. Think of it like the holds list. You're getting bumped up the holds list for items that you need. So ordering through them is an option if you don't have a local resource to turn to. Anyone else have any leads on that?
I'm making,
So the Amazon.
Sorry, I'm making our own cloth masks, and that's the ones we have available for our patrons that I just have there, that if they don't have one, they can take one. I offered them to all my staff. And then I talked to my medical professional because we can't find wipes anywhere. And he says, as long as I do the Clorox water, you know, CDC approved, we're going to put baby wipes soaked in the Clorox water and make our own wipes.
So far the Amazon's the best you can get. If you have a business account, it opens you up into the COVID-19. You get first dibs on stuff. But Amazon has asked that people not order until they need it, because at this point, first responders are actually ordering off of Amazon. So they're trying to save it for them.
And this is another instance where it'll kind of depend on what state your community is in. So if your community is harder hit by the virus and your first responders need that equipment far more than anybody else in the area, it makes sense to not get those materials and make sure they have them. Even in an extreme case, if that means not being able to provide curbside service, if you don't have adequate cleaning materials to provide that, you know, it makes sense to just not until you adequately have enough materials to make sure that your staff is safe.
There's a suggestion in the chat to check restaurant supply services. That's a great suggestion. That's something that I've also heard for like paper products. So I'll share a secret with you. I've heard in town here in Boise that going to like the dollar store where you maybe wouldn't normally be going to buy some of these things is a place to go. So so kind of thinking more broadly about where you're sourcing materials from is a great suggestion.
Staples.
What's
People
that?
don't think Staples. People don't think to go to Staples for toilet paper and that kind of stuff. So.
Exactly. Yeah. So you know, put on your creative problem solving hat and think about other industries that are needing to buy these things as well.
My brother just went to Lowe's and found quite a bit of stuff, and he's in Utah, but he was saying that Lowe's their distribution is getting better. So that might be another good resource.
That's great. Thanks, Rochelle. There's a couple, so we're at 11 o'clock, but there's a couple of great questions in the chat that I want to make sure we get to. So we won't take it personally if you need to jump off. Thank you for joining, but if the rest of you are okay hanging in. There was, where was it? Oh, is Clorox the only cleaning agent, or can Pine Sol and Simple Green? I know the CDC, I believe, has a list of products. Oh, cool. Someone put a link to it, perhaps. Yep. Thank you, Annie. So there's a link there to the cleaning products that the CDC has determined actually clean surfaces enough to remove the virus. I also put a link to a no-sew face mask. So people talking about wanting to provide masks to customers coming in, but maybe not being able to buy them. Some mask is going to be better than no mask at all. So a simple pattern, and that might be something that staff that you're needing to find tasks for, perhaps that's something that they can be put on. Also, if any of you have a Cricut or a Silhouette, some sort of crafting cutting machine like that, I know that there are SVG files for no-sew masks that's something to look into as well. Put some of that technology to use that's maybe sitting there dormant in your library. Oh, interesting, automotive repair places. Emily, that's a good one. I hadn't thought of that one yet. Brilliant. Over in Glens Ferry, it looks like they've reached out to the fire department to add onto their order if possible for cleaning supplies, since nice, are both city departments. It's a great suggestion. So if you're a city library, or if you somehow have a connection with another municipal department, seeing if you can piggyback on their order, that's great. People who have asthma and chemical sensitivities may also not be able to enter the library now. Yep, not a question, but something to be aware of. Susan, that's a great point. And that was something that even us at the commission, when we before we were working from home, we were going to have a rotation of where some of us were in the office. And then we also were instigating a cleaning regimen of the office. And that was one of the things we talked about, is having those cleaning days be specific days, so that way people that do have sensitivity to some of those chemical smells are not as impacted by it. So something to think about, if you're maybe only going to be open for a few hours during a day, maybe you're able to schedule some of that deep cleaning so that it doesn't impact your patrons as much. But yeah, a great suggestion, opportunity for signage. Is there an area you can create that that is still safe to be in, but maybe doesn't have as much of that kind of chemical odor going on? Oh, interesting. Caxton is coming out with paper products and wipes. Makes sense. Oh, good old Caxton. Another thing that I've been seeing is that some distilleries are making hand sanitizer. So that is, if there's a distillery in your community, see if that's something that they've been making.
I heard it advertised on the radio as like small batch, bespoke hand sanitizer. So,
which that screams expensive to me, but maybe they'd be willing to donate, some to a good cause. Are there any late-breaking questions that people have for the group or for anyone in particular? I hope this chat was useful for you and that you feel a little more informed to move forward. That was our goal. We can't give you the answers, but we're here to give you support along the way, to help you as you do make those decisions for your community. I hope that you all stay safe and well, and that your friends and family do as well. Like I said, this is being recorded, so we'll get the recording up and we'll send out something to the listserv, the recording, and the resources that were shared are up. And with that, I will tell you all to have a lovely day and to take care and keep doing the good work that you're doing. Thank you for joining.